Are you in EMS or the medical field? If you are, chances are you have seen 1 to 15 videos over what is affecting our nation right now, which is the coronavirus, or more specifically, COVID-19. I'm sure you've seen both sides of the extreme, right? You've seen the people who are walking around in hazmat suits and hoarding all the paper goods. And then you see the people who don't think this is a big deal or an issue. In this video, I'm gonna go over the CDC recommendations specifically for EMS clinicians, and even more specifically, the EMS clinicians that are on the 911 ambulance. I wanna be clear that the information in this video is not professional medical advice. It's just basically me relaying what the CDC is recommending for EMS clinicians to EMS clinicians. Keep in mind that not even the doctors know everything there is to know about COVID-19. So as of today, which is March 14th of 2020, this is what the CDC is recommending. As always, thank you guys so much for tuning into my channel. If you are interested in EMS content, I post here every single week, so hit that subscribe button down below. And if you want to be notified when I post a new video, hit that notification bell. The hysteria of the coronavirus, or COVID-19, has taken over our news, our retail stores, healthcare professionals' lives, and the world. It is extremely important in these situations to be safe and cautious, but we also don't want to add to the panic or the hysteria of the world right now. Okay, a few things that the CDC has told us that we do know about COVID-19 so far is that our patients are typically presenting with a cough, a fever, and shortness of breath. Now, there may be more symptoms that the patient could experience, but overall, it's cold or flu-like symptoms. Just be aware of this, and if your patient is presenting in this way, start to take the proper PPE precautions. Another fact about COVID-19 is that it is hitting the elderly population and those with compromised immune systems, compromised respiratory systems the hardest. I've heard so many people say, why are you worried about it? You're young, you're healthy. Yes, all that is true. A lot of EMS providers are young and healthy, and it isn't necessarily that we're worried about ourselves, but it's about spreading it to our elderly patients or our elderly friends or family. I can pretty much speak for most people in that we know or love someone who is older, whether it be our grandparents, our parents, our great-grandparents, or someone who has a compromised immune system or respiratory system, or someone with comorbidities. And we would not want them to contract something like this, because in the grand scheme of things, they're gonna have a harder time fighting something off. So be cautious of this and take the proper PPE precautions and hand washing procedures and all of that, which we'll go into a little bit more in this video. Another fact is that some of the dispatchers and some of the dispatch systems are starting to ask the reporting party or the person that called 911 specific questions in order to relay this to EMS. Now, every area is different, so I can't speak for every area, but I know specifically in my area and several others around me, the dispatchers are starting to ask the reporting parties if they're experiencing fever, shortness of breath, a cough. And this is awesome for EMS personnel because we will know prior to arrival what kind of PPE we need to put on. Of course, we always put on gloves, right? But if we're suspecting that it's COVID-19 or it could be COVID-19, then we'll know to put on all the other PPE that is recommended by the CDC, which we'll get into in just a few minutes. And a side note, guys, this is why I don't understand why so many people don't think that dispatchers are first responders. They are literally our saving grace. In these situations, they're relaying this information so that we go into the scene safer and more informed. So if you know a dispatcher, say thank you, because they're amazing and they are 100% a first responder. But after dispatch does this for us and we enter the scene, then the ball is in our court, right? Then we are responsible for relaying or dispatching this information to the hospital. They are doing it for us, but we need to do it for the hospital too, because there are certain precautions that the hospital needs to take and get ready for if we're possibly bringing in a patient that has COVID-19. Just like I always say in my Medication Monday videos, always abide by your local protocol. Your location or your service may have a specific set of rules that they want you to follow. I know specifically my department wants us to alert the hospital and let them know that we're bringing in a patient that is meeting the criteria for COVID-19, but they also advise that we don't get on the radio and say that our patient has COVID-19 or possibly has COVID-19. Rather, relay the symptoms that the patient is experiencing and relay that you are taking the proper PPE precautions for this patient. That way they know what's going on and you don't have to get on the radio that other people could possibly be listening to and create more panic or hysteria. Okay, so if dispatch has advised that there is a patient that is exhibiting possible signs of COVID-19, the appropriate PPE that you want to put on, which this is recommended by the CDC, so anybody watching this video, don't come for me. I'm just reading the CDC website, which I would recommend that you read, because there's so much about this disease that is unknown that this could change in the future. So make sure you check out cdc.gov. But as of right now, March 14th of 2020, the PPE includes your disposable gloves, which you should be wearing those on every single call anyway. They are also recommending eye protection, like goggles or face masks that cover all the way around the side of your face. And they're recommending an N95. And if you don't have N95s, because there is a shortage right now, obviously, because everybody bought them up, but if you don't have one, then a face mask is a good alternative. Also, they are recommending the gown. And if you're low on gowns or your service only has a few gowns, they're recommending that you save your gowns for the aerosol generating situations or high contact situations with your patients. So if you're giving them a breathing treatment, if you're intubating them, things like that, they're recommending save your gowns for those situations. But if you have plenty of gowns, make sure you have all of that PPE on. Another thing is that some services are limiting the amount of EMS personnel to be exposed. Now, my specific department runs with 3 EMS personnel per call. So if we have already established who's going to be the driver, most likely we're not going to have that person get in and assist with patient care because we don't want that person exposed. We want as little exposure as possible. But if they were to help move the stretcher or lift the patient or come in contact with the patient at all, they would need to don the right PPE as well. But before they get into the driver's seat, they need to take off all of their PPE and dispose of it. But there's a catch on this one too. If you don't have a driver's compartment where you can close the door and completely seal it off, then you need to have your driver keep the N95 mask on while he or she is driving. Also, if you are going to do an aerosol generating procedure like a breathing treatment, if it's possible, do all of this before you go en route so that you can open those back doors, turn on your HVAC system so there's less chance of spreading it. Also, something that I know that you've heard, you've been taught, you've practiced before, but I have to say it, make sure that you're practicing the proper hand washing technique. And if you don't have access to soap and water, make sure you're using hand sanitizer. Also, get into the practice of not touching your face during these calls, but even outside of the calls. It's just good practice in the healthcare field to just not constantly be touching your face. If you suspect that you've contracted COVID-19 or you're displaying symptoms of COVID-19, report this to your supervisor immediately. And if you're experiencing them prior to going into work, don't go into work. As all of you know, they are canceling so many things all over the US. Public gatherings, events, school, anywhere where lots of people congregate. But one thing that isn't canceled is EMS, healthcare workers. We all have to go to work. So if you think you're sick, don't go to work and infect the people that we need to be well. All right, y'all, that is just some of the advice that the CDC is recommending for EMS clinicians at this time. So make sure to keep yourself informed and updated on that, and make sure that you keep yourself safe and your family safe, and don't add to the panic and the hysteria of this world right now. We need people who are going to stay calm and rational. Anyway, guys, thank you so much for watching every single week, and until next time, I will see you later. Bye.